Hello, very good afternoon to all. Today our session is about the PCO resistant cases where they do not show any response and they do not show any follicle with the tablet clomiphene. They are called CC resistant cases of PCO. They are obese patients, they are having high level of insulin, and they are at the risk of developing cancer and diabetes and coronary artery disease. And they are the one they have to go for HMG and FSH injection for the PCOS, control ovarian stimulation. And majority of these patients, they are also at risk of developing OHSS, ovarian hyperstimulation syndrome, which will be very, very severe cases. And they will also have a risk of having a kidney failure. They will also have a risk of VIC. And basically, very big dilemmatic cases, challenging cases in our disease. Therefore, these cases, they should be handled by the most experienced ART infertility specialist. What we do after thorough evaluation, once we know they are the one CC resistant, we're giving them a 4 to 5 to up to 6 cycles with the highest propensity and estimating the level of the insulin and their BMI. These patients they will be given a thorough counseling about the injections and also IVF, ART, very similarly to this patient what you have seen. And they will also have a segmented IVF where the oocyte aspiration should be separated from their FAT program. As we know that these patients, they have a multiple egg aspiration, sometimes 45, will be risking their life because they will have a problem. But with the control ovarian stimulation and this advancement in the FSH and recombinant FSH, the risk of OHSS has come down drastically low. And with the very utmost expertise, these patients' COS can be completed and their oocyte aspiration and their ICSI program, and we can have a very good embryos and blastocysts in the stage and first phase of the treatment in these patients. According to the many expert embryologists, their embryos and their blastocyst mostly is granular because of the high level of the insulin. But then once we do segmented IVF and we do the transfer of the embryos after 2 months or 3 months, then with the development of the endometrium, then they will stand a very good chance of success, which is saying about 50-60% up to 70%. What this patient we have shown you is one of those very challenging cases where she was not getting conceived, and with the high dose of the OHS, with the high dose of injection, she had developed OHSS, and basically very complicated case where I do not want to talk much about this particular case, but there are very, very difficult, challenging cases where it is everywhere the same scenario is there: risk of OHSS, risk of hyperstimulation, and risk of they having basically DIC and affecting their kidneys. They should be handled with utmost expertise and expert handling, and we have to also consider them for an antagonist protocol with fight and recombinant FSH. And segmented IVF is the best solution.